At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend Hormones, Menopause, Andropause, and Beyond on Wednesday, November 13th at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellcare.com.
The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle DC, interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
This is Dr. Tom Roselle Live on 105.9 FM WMAL.
Hey everybody, welcome to Dr. Tom Roselle Live. We have another Sunday that is kind of exceptional coming up, right? Many things are happening. It's like the 12 o'clock midnight hour this coming Tuesday is right in front of us. We wondered how long it was going to take to get there, but it's here. So you need to make sure, if you haven't voted, get yourself out there and vote. Whatever your choice and flavor is, go and push that button. It's important. It's critical. This is, I've been at this game called election processing for years, meaning my process is in my own vote. And if you don't push the lever and vote, you really don't have a basis to complain later on or what's going to happen. So whatever your hallucination is, make sure you go vote for that, okay? So for me, it's real simple. It has to do with healthcare and freedom of choice when it comes to healthcare. Things like right to try and so forth. And I just kind of put the things up there and say, okay, this guy supports this. This one doesn't support this, and it's an easy situation. I take away the faces, I take away the personalities, and I really look at issues. So get out there and get it done. Make sure you do it. Whatever your flavor is, make sure you vote before. Some of you, I think some of the early voting is closed now. But this Tuesday, a couple of days from now, you need to get out there and do your thing. Let's get into the program. And it's going to be a kind of a continuation of what we've been talking about, but I want to consolidate it. What do I mean by that? Well, we've been talking about hormones and what they really do, and the accumulation of fat around your belly. We'll touch on that just a little bit. But more importantly, what are hormones and what do they really do to your body? Why don't we start with that? I realized after listening, to some of the programs over the last couple of weeks that I touched upon it, but not in a way that may be totally, completely understandable. So, if we said something like hormones are the secret of life, it really is. It's true. So the first situation is that hormones can do all kinds of things, like telling the body where to put fat in. It can tell you how to grow. It can tell you how your energy is going to be. It's going to get you to be able to be interested in the opposite sex for procreation and reproduction. So there's a lot of different pieces of that pathway. It's astonishing to me that we're still getting deeper and deeper into the understanding of what hormones actually do. And, these little small, what we, esoteric jobs, not just those things, but we're seeing major physiological implications when hormones are not balanced properly and not working. So it's not just a matter of going out and having your doctor prescribe Synthroid, which is thyroxine, which is a hormone that the thyroid produces, or telling you now with the new advertising out there that you have pancreatic insufficiency. And those are enzymes, like amylase and protease and so forth that break down foods but it's only one of the pieces of the puzzle. They don't tell you the rest of the story. So, if we roll the clock back and we look at the 1920s and 1930s, when they started really studying different extracts of glands, they yielded several new hormones and that they were understanding of back in the day, and it's called testosterone. Not until then do they really understand it. Estrogens, and something called adrenocorticotropic hormone. And that's one that signals the adrenal system to do some interesting things as well. So, by the way, as we're getting into that, I want you to remember that coming up on the 13th of November, basically 2.5 weeks, at the Roselle Center for Healing in Fairfax, we're going to, no, it was less than 2 weeks. Wow, time flies by when you're having fun, right? The Roselle Center for Healing in Fairfax, 6 p.m., Dr. Stephanie Pina and I are going to be going in depth into the hormonal jungle. And we're going to look at the pain patterns that you might have, the breathing patterns that you're struggling with, the transitional pieces from menopause, from that and guys' andropause. And we're going to really talk about them but identify specifically why these things end up problematic, if you will, with the symptoms that are there. And then we're going to get into diabetes as well, because if you're a diabetic, you have a hormonal problem, meaning insulin isn't working the way it's supposed to. So the question becomes, why is that? Not just fixing the symptom. So we're going to try to do that. When I get into the second part of the program today, we're going to talk about some very specific targeting. The second part of the program is Ageless Health live stream that you're going to go to immediately after you listen to me here on WMAL 105.9. So here's what you're going to do afterwards. You're going to go to Dr. D-R-T-O-M, Roselle, ROSELLE.com, drtomroselle.com, and you're going to go in, and it's going to be a little tag there. You're going to hit it, and it's going to take you right in. You're going to see the old face, and we're going to really get into some of the signaling and what it really means and get that done for you. But remember that it's not enough to supplement putting in artificially the different hormones. It's a matter of understanding really what's going on. Now, when we look at fat accumulation in the cells and things of that nature, there's all kinds of things that we really need to understand. There's a common group of something called anti-diabetic medicines. They're called, the name is huge. It's called thiazolidinediones. Did you get that one? And they act on different kinds of fat cells, and they broke down in different substrates, but we won't get into that. Just, put in the back of your head, you heard it at one time, and if somebody tells you again, said, yeah, I remember hearing that someplace, but not sure where it came from. Now, so here's the deal. When you look at all the studies out there and they start tracking the different hormones and how they affect the body's expression, you really have to sit back and say, this is one complicated puzzle. It is and it isn't. It becomes complicated when you start looking at the symptoms that are occurring because the hormones are not balanced properly. But we got to backtrack it. If you know me, you know that I'm going to start asking, why is that? Okay, so example, back in we'll say recently compared to everybody's study, 2013, researchers found a connection, and that they found that fat tissue, adipose tissue that collects around your blood vessels, that's what everybody's worried about, right? Secretes a hormone known as chemerin, 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 and it acts as a vasoconstrictor. That means it narrows the blood flow, and therefore, what does it do? It raises your blood pressure. So this hormone, right, this chemerin, Chemerin, acts to tighten the blood vessels down because there's fat that's accumulating around the blood vessels. That's where the old cliche is that you got a skinny fat person, and that person is accumulating fat, but not like a lot of us do around the midsection and other areas and so forth. And they're more at risk for cardiovascular problems than somebody who might be over heavy. So we have to understand that. So when you get into it and you really start digging, and there are many hormones produced by fat cells in humans. So remember I said it's not just fat, but it's what the fat cells do. So they produce different hormones. One's called leptin, another one's called adiponectin, another one's called chemerin, another one's is called asparagine, another one's called lepocalin 5, and then there's another one called SLIT2-C, and it goes on, and there's a whole bunch of them, right? And when you understand that these all have different jobs when it comes to blood metabolism. And some of these things cause, this fatness, if you will cause increase of inflammation. The 13th of November, I'm going to get into it a little bit. I'm going to start finger pointing what really takes place, how it dampens the energy platform sometimes, how it causes pain to occur, and the things that you need to do from a neurological, biochemical, and emotional platform. So we're going to connect the dots a little bit in the next part of the program, and we're going to get into this, and we're going to really kind of lay it out specifically. So, connecting the dots, what does that mean? It means that with each new hormone that these guys are discovering, is it really that they're discovering new hormones, or there's subfractions of other hormones that are out there? Well, the answer is yes and yes. And so they're finding ways to treat different conditions because of that, but particularly all these drugs now that you see for, way too fat and obesity and so forth. But again, are they causing more of a problem than they are providing a fix, a resolution that your body can kick back in and do what it's supposed to do? Well, I'm here to tell you that it may be a little bit of both. And, it's great to drop the weight, and you see all these ads on television and say, and I lost 25 pounds. My insulin now is under 8. Well, God help you. I hope it's under 8, because you're still a raging diabetic if it's anywhere, over 6.4, 6.5. So we have to take that into consideration. So we have to look at all the interconnected pieces from the brain and its signaling. We talked about the different things like thyroid stimulating hormone and luteinizing hormone and follicle stimulating hormone and adrenal cortical stimulating hormone. And they all have little side venues, if you will, that allow your body to take the signal and move forward. Let's take the thyroid just for a quick second before we go on. The thyroid produces a hormone and it's stimulated by hormone. So let's go back up. Let's start at the pituitary. Thyroid stimulating hormone tells the thyroid what to do. And then, so your doctor measures in your blood TSH, thyroid stimulating hormone. Then they used to measure just one other hormone. It's called T4. T4 is thyroxine. It's the primary hormone, 80%, that the thyroid produces. Now, what happens to that thyroxine? It's got to be converted into an active hormone called T4. But when the laboratory measures it, it only measures it as a percentage. So it could have a good high percentage of T4, but if the T4 is low, that percentage is high of the lower portion. You following me? So it's not really measuring. But so there are 8 different hormones that have to be measured when you do a real thyroid test. And I'll get into that also on the 13th when you join me at the Roselle Center for Healing. And by the way, how you register for that is real simple. Go to drtomroselle.com. You can do it that way, or even better, go to rosellcenter.com. That's ROSELLECENTERE, rosellcenter.com, and register. And you'll scroll down, you'll see the class, click it, put your name in it. But just remember, do me a favor, please. If you can't make the class, reach out and let us know you can't make it. That way we'll have a seat for somebody else. And those of you who have attended the classes, remember, I do this because I want you to have the information. And, at that point, we'll give you opportunity to do something with it, but you have no obligation coming by. It's not costing you anything. And there's no hard sell. We're not selling timeshares or anything like that. But join us. I promise you're going to learn a lot. And even if you're a patient, come in and really get an understanding of this. But we're going to talk about, in the next part of the program, we're going to talk about the hormones that can play a significant role in fat accumulation and the distribution of fat, where it's actually going. And there's just as a superficial, we're talking about leptin, we're talking about insulin, we're talking about 2 things called oestrogens. Now, and I didn't say estrogens, but oestrogens, because there's different pieces of them, androgens, and growth hormone. And so they all have an act, but they all have also subfractions of what they are. So we'll touch upon that, but we'll really get in depth on the 13th. I don't know why I want to keep telling you it's a different date, but I'm doing that. So it's the 13th, November 13th, and we're going to be there at 6 p.m. So register for the class. So there's tons of studies. The whole idea is to put it together in a way that it's understandable, that you get it, that you really understand how the body in this intimacy and this beauty really makes things work the way it's supposed to. And there's multiple pieces that are involved. Everything from the stomach to the pancreas to the adrenal glands. We've talked about that, to testicles, ovaries, feedback mechanisms, the leptin that accumulates, in different areas, and the adipocytin levels. There's lots of different pieces of this puzzle, and I want you to understand it, how this mechanism works, how, that craving that you get for stuff that you shouldn't be eating. Why do you get it? What happens? Let's make that happen. The perimenopause that we've talked about, the menopausal problems, the andropause, you guys bark and yell and scream and carry on, and you weren't like that before. What's happening? Those are all hormonal shifts. And, I don't want to get out of my rocking chair and, go outside and do anything productive. That has to do with hormonal regulation. We were talking the other day with a patient. It was really funny. And he's probably about 69, 70 years old. And the guy, if you look at him, is not in bad shape, but his energy and his motivation has gone out the window. And I said, okay, so we kind of walked through it. I asked him, if he'd had any ED problems. He said, yeah. He said, I guess. I said, what do you mean you guess? And he said, well, he said, I still get an occasional erection in the morning. I said, well, your hormones aren't completely dead, I told him. And he says, but I have no desire to do anything with it. So I looked at him and I said, that's a neurotransmitter problem. That's called dopamine. It's not triggering the rest of your, if you will, hormonal function, to do why it's there. And he just looked at me. And so we ordered a test called a urinary neurotransmitter test to find out what those levels are. See, those are another piece of the hormonal complex too. You got to backtrack it now to that. So your neurotransmitters are the ones that make you want to do anything. It's your feel-good juices like serotonin. It's your motivation juices like dopamine. It's your settling down juices like GABA. And so we have these different chemistries, these neurotransmitters that will produce different types of hormones. And so we begin to see it. So, when we look at the different pieces of the puzzle, like how many of you have that big round belly fat around you, right? That has to do, and it's really soft and it's jelly-like, and you got soft, pudgy arms. That's usually a thyroid belly fat. And you go in and your doc says, well, you're within the parameters, but those parameters are so damn big that they really don't fit you. There's something other than that that's going on. So if we understand why that's happening, the next question is, why isn't the thyroid working when your doctor says there's nothing wrong with you? That's why there's 8 different tests that you have to do with thyroid and some physiological tests as well. You, as the patient, are not a textbook. You are not a textbook. You are you. Your body tells you what's going on, and you have to look at that specifically that way. So whether it's fat burning or storage of other hormones in the body, where do they occur? Is it a cortisol storage pattern? But you keep going back to the doc and they say, well, everything's cool. Maybe, and maybe you got something going on that somebody is missing. But I promise you, when I'm done on the 13th, and Dr. Pina is done on the 13th, you're going to have a different look at the whole puzzle. You're going to have probably a better understanding than most of your doctors do. Now, I'm not saying all these guys are bad guys. It's not true, because there's some really, really good people out there that know their stuff, and they approach it in a specific way. We approach it by looking at the things that are being interrupted within the body, but ask the question, why is that taking place? Why are you having problems with, menstrual problems? Why are the fibroids there? Why are the endometrial tissues there? Why is pain so bad on, urination? Is it because you have an infection, or is it a hormonal disruption that could be taking place? Why is that back pain always present, no matter what you do? You get it feeling a little better, but it never, ever, ever goes away. Why do you get these damn migraines and they just never leave you? And you get treated, even structurally. You get a structural adjustment, you get some acupuncture, but they never shift. Could it be partially that there's an imbalance in the hormones, or even backing it up into the neurotransmitters that are there? Let me give you another piece of the puzzle when it comes to hormones that most people, because everybody's focused on thyroid, right? So we'll do this real quickly when I want you to think about it. So your thyroid, as I said a minute ago, produces a hormone, and it is stimulated by a hormone. Now, the hormone it's stimulated by is TSH, thyroid stimulating hormone. It comes from where? The pituitary. And it produces another hormone called thyroxine, T4. What happens in between? Well, if the thyroid is not irritated, inflamed, swollen, if there is enough iodine and tyrosine, a neurotransmitter, and trace amounts of certain types of minerals, then the thyroid can produce certain levels and adequate levels of the hormone thyroxine. Now, they don't tell you about that piece, right? They just say, well, look, let's put this in there. So now you got to distinguish, is that a problem? Why is it a problem? And where's it coming from? And how do we handle that? Because there's a feedback loop, if you will, that basically hides what really is taking place. Some of it is hidden because there's not a really good understanding by your doc, your physician, your nurse practitioner of why this nonsense occurs. And they just throw something at you, either T3 because it's the active hormone, but T3 only works well if it can be upregulated, taken up into the system. You can measure that with a blood test called, T3 uptake. But if you don't do that, you don't know whether it's coming into the system or not. But we're going to get into that a little bit more, in the next part of the program. I think you're going to appreciate the insight, if you will. But I want you to remember something. Don't forget to follow me on all your social media sites, whether it's Facebook or Instagram or LinkedIn or X, because we're on all of them. But you got to follow me. And if you do that, we'll let you know immediately when we're sending out all kinds of data and making sure you have that information available to you. But coming up, again, mark the date and make sure you register and you come into the office on the 13th of November. And by that time, God willing, we'll know the end result of this election. And we'll be able to move forward one way or the other, knowing that, whoever is in the pilot seat and controlling this, they'll give us keys, and particularly in my world, in healthcare, we really want to know. And I'm having an interesting meeting with an amazing attorney in a couple of days. Guy is really incredible. So make sure, you're here on the 11th. Make sure this coming Tuesday, if you haven't voted, that you do get out and vote. Don't just sit there. Please don't sit there. Go vote. Make it happen. Make sure that you're heard. You're accounted for. If you're like me, you're going to vote for somebody who supports health freedom, and that means your choice to do what you believe is the most important venue, the most important road for you and your family. So make sure you get that done, okay? Because if you don't, you got nothing to complain about except point the finger at yourself, because you were part of the problem, not the solution. Having said that, my friends, join me right now on Ageless Health live stream. And we're going to continue the process of unveiling your hormones. This is Dr. Tom Roselle. Remember, I do this every Sunday for one reason. You deserve it, and I love you all. Have a great day.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.
Neuromuscular dentistry is more than just teeth and gums. Temporomandibular joint disorder is a very painful disorder, which only a skilled neuromuscular dentist can diagnose and treat. If you're in pain and suffering from TMJ, call the neuromuscular dentistry experts at Soft Touch Dental Care. Learn more about TMJ and how Dr. Michael Chung DDS has successfully treated patients. Visit softtouchdentalcare.com or call 703-319-6990.
At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend Hormones, Menopause, Andropause, and Beyond on Wednesday, November 13th at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellcare.com.
This is Dr. Tom Roselle. After 43 years of practice and over 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellcare.com. That's rosellcare.com.